Are you a woman in your 30s, 40s, or 50s? And have you noticed that your mouth just feels drier than it used to? First thing in the morning, mid-conversation, or even after a glass of water. Or maybe you've had 2 or 3 cavities this year after a decade without a single one. If so, stay with me because this isn't random and it's not just about getting older. It might be one of the earliest signs of perimenopause showing up in your mouth before it shows up anywhere else. Different symptoms, same story. I'm Dr. Joanna Claustro, a functional and cosmetic dentist, and I didn't learn about perimenopause in dental school. I lived it. And today I'm walking through why symptoms of perimenopause show up in your mouth and how your dentist might be one of your greatest allies in catching the signs early. Now, I'm no stranger to running on very little sleep. Between owning a dental practice and raising my son under pressure is basically my resting state. But the second I hit my 40s, burnout didn't just creep up on me. It hit me like a ton of bricks. Not the regular kind of tired, the kind where you know something underneath has shifted and you can't navigate these waters on your own. And what felt like years of rowing hard against the brain fog and the fatigue, I finally went to see a functional MD, half expecting her to tell me to stop scrolling at bedtime and to meditate. Instead, she listened and helped me realize I had entered perimenopause. Part of what I had been feeling, the dry mouth, the fog, the fatigue, wasn't just some sudden loss of ability. It was my hormones shifting. Not fun, but totally normal. There wasn't anything wrong with me. I just didn't have the right tools yet to get through those rough patches. That aha moment sent me down a research path that has changed the way I understand how our bodies function and the role hormones play in maintaining balance throughout. These aren't just sex hormones. They regulate our saliva, our ability to cope with stress, the density of our bones, and so much more. And as my understanding of the biology widened, I was able to connect why I suddenly noticed my dry mouth and why my clenching had gotten worse. And then I couldn't stop seeing the signs showing up in the very women sitting in my chair. That's when I understood how far this transition reaches, right down to something as ordinary as our spit. And because of what I do for a living, I know I have a real opportunity to make a difference. I'm not only a woman who happens to be in perimenopause, I'm a dentist who cares for women going through these changes in their lives every single day, just like me. This is the first of a series of videos where I'll be walking you through the different ways perimenopause reaches your mouth, why I'm usually the one who notices it first, and what helps, so that this stage of life doesn't have to cost you your comfort or your confidence. Saliva production is one of the first symptoms to feel the impact of this hormonal drop. And here's what's happening. Just like the cells in your heart, your uterus, and your nervous systems, the cells in your salivary glands have estrogen receptors that direct their normal function. And as estrogen starts to fluctuate, so does the production of saliva, leaving you a dry mouth or saliva that's thick and sticky. The significance of this goes beyond just discomfort. Saliva is so much more than a lubricant. It washes away food particles, neutralizes acids, and carries minerals that literally rebuild the enamel. It's your mouth's first line of defense against cavities. Cavities are formed when acids sit on your teeth and itch away at the enamel. These acids come from the foods we eat, the bacteria that produce acid as a byproduct when they eat the foods we eat, and also from your gut. When saliva is reduced, your body is less able to wash away and neutralize the acids carried in plaque. So when salivary flow slows down during perimenopause, a few things tend to follow. Your cavity risk can go up, even if nothing in your diet or brushing habits have changed. Your oral tissue and gums become more prone to irritation, inflammation, and sensations of burning can show up. And your taste can shift. Food you have enjoyed your entire life can taste metallic or simply off. In fact, it's these other symptoms that you or your dentist may notice before detecting the actual dryness in your mouth. Even when I can see the evidence of reduced salivary flow, many of my patients will deny ever feeling dry. That's why conversations around these findings are so much more important than a dentist simply handing you a treatment plan for fillings and instructing you to brush better. I always get curious when a woman in my chair is experiencing an uptick in cavities after years of clear checkups. She's usually surprised, and so am I. I want to know what's changed in her habits, her stress levels, her menstrual cycle. I take a close look at her saliva and look for other signs in her mouth that may suggest a drop in estrogen function. These conversations may seem odd at first, but just like my own aha moment, once we start connecting the dots together, it starts making sense. And we can all agree that yes, perimenopause sucks. But none of this, the cavities, the dryness, the taste changes, means you've done anything wrong, nor is anything wrong with you. This is not merely a failure of hygiene, but a normal hormonal shift. You, like me, just need the right tools to navigate this new baseline. So here's what helps. And I promise you don't need to overhaul your life to make a difference. To help prevent cavities, we have two main goals: neutralize acids and remineralize enamel. Staying hydrated is critical when dealing with dry mouth because debris and acids aren't being washed away by your saliva. Sipping water throughout the day makes a greater impact than chugging a bottle around meals. Saliva-stimulating products like xylitol gum or mints can also be helpful. And there are a wide range of gels and rinses that actually mimic the buffering and lubricating actions of your natural saliva. And of course, your home care becomes so much more important during this time. It is your first line of defense against dry mouth during perimenopause. An electric toothbrush, textured floss, my personal favorite is cocoa floss, or even a water pick can make a huge difference in your overall comfort and the prevention of cavities. To boost remineralization and to strengthen your enamel, fluoride in appropriate doses continues to be the gold standard within the dental community. But it's also not your only option. Hydroxyapatite, peptide therapies, and probiotics are some of the other options and tools we offer at my practice to prevent and treat early signs of decay. And most importantly, stay up to date with your dental visits. If you have noticed any of the signs that we have discussed today, your dentist can help you. Identifying risk factors and catching problems early almost always means better outcomes. And working with a dentist like me, who treats you as a whole being, can help you not only smile with confidence, but live with confidence too. So give us a call to schedule an appointment, and let's take a close look at what your mouth may reveal about your overall health and well-being. Up next in this series, I will be exploring the connection between gum inflammation during perimenopause and your cardiovascular health. I hope this video inspires you to get curious about what you feel in your body, in your mouth, or deep in your instincts. If you learned anything at all and would like to learn more, please give me a follow and share with a friend, because we do not have to go through this stage of life alone. Thank you for watching. Cheers.